What is a sprain? A sprain is an injury to a ligament tissue that connects two or more bones at a joint. In a sprain, one or more ligaments is stretched or torn. What causes a sprain? Many things can cause a sprain. Falling, twisting, or getting hit can force a joint out of its normal position. This can cause ligaments around the joint to stretch or tear. What are the signs and symptoms of sprains? The usual signs and symptoms of a sprain are pain, swelling, and bruising, like you can see in this photo, or not being able to move or use the joint. There are 3 different grades of ankle sprain. Grade 1 is mild. In mild cases, you can expect full ligament healing to be within 2 to 3 weeks. Grade 2 is moderate. Grade 2 injuries occur when you have a significant ligament injury that allows the ligament to excessively stretch. In most cases, these injuries result in a recovery period of 4 to 6 weeks. Grade 3 is severe, and Grade 3 ligament injuries are when the ligament is completely ruptured. Most severe ankle sprain injuries can also include fractures of the bones or high ankle sprains, which will require additional rehabilitation time to a simple lower ankle sprain. For a Grade 1 sprain, follow the Rice guidelines: rest, ice, compression, and elevation. Swelling usually goes down within a few days. For a Grade 2 sprain, follow the Rice guidelines and allow more time for healing. A doctor may immobilise or splint your sprained ankle. A Grade 3 sprain puts you at risk for permanent ankle instability. Rarely, though, surgery may be needed to repair the damage, especially in competitive athletes. The most common basketball injury is the ankle sprain. This injury often occurs when a basketball player lands on another foot or the ankle rolls too far outward. This often happens when defending.